I'm obviously biased. I think ophthalmology is the best medical and surgical specialty out there. And so why wouldn't everyone want to learn more about the eye? But I do think if we can demystify looking at the fundus earlier on, I think we would get a lot more people interested in ophthalmology. I don't know if we necessarily have all of the residency spots to do that, but I think when I was going through the clinical skills curriculum, we used a direct ophthalmoscope, and most of the time we just faked, oh yeah, I can see the optic nerve.
And they didn't.
Right. And they didn't. And plus, to be honest, a lot of those direct ophthalmoscopes
didn't work.
The lens in there is so dirty. Even as an ophthalmology resident, I was using those. I said, okay, no wonder no one can see anything. But I think if we can really get medical students access to that early on, that can probably stimulate a lot of interest. Like the ultrasound lab that was done, right? Learning how to do a B scan. All of a sudden students were like, oh, okay, this is what the inside of an eye looks like. This is the anatomy of an eye. That's kind of interesting. This is how light enters the eye, hits the retina, and does all of these things. Whereas before it's just, maybe 1 or 2 hours of a lecture in the traditional medical student curriculum.
And I think having that experience, the experiential component of it. And so before COVID, we have a course here, Clinical Skills, and I was speaking with the 2 course co-directors for Clinical Skills to have ophthalmology be a component of the case. And we were actually looking into integrating it because I think it's really important for ophthalmology not to be something that's a part, but an integral part. So they had 2 cases that we were looking to bring ophthalmology in. One was an MS case, and the other was a diabetic patient. And to, just as you say, to get students familiar with the fact that the eye is part of the exam for both of those, and it's not something that you just pick up the phone and call the ophthalmologist. That it's part of the. You don't pick up the phone and call the cardiologist when you want to know the heart sounds.
Right. We have a significant amount of the cranial nerves. Can't deny that.
That's right.
To me, the eye is a very critical part of the human body, and people who are surveyed about their greatest fear in life, public speaking is up there, but going blind, most people would rather lose one of their other senses than lose their vision.
Absolutely. Absolutely.